Hi there, thank you for watching our Healing Response YouTube channel. My name is Ayla Wolf. I am a doctor of acupuncture and oriental medicine and licensed acupuncturist practicing in Stillwater, Minnesota. And in our clinic, we specialize in neurological disorders. Today, I want to talk about the difference between dizziness and vertigo. Symptoms of dizziness and vertigo are often some of the most misdiagnosed symptoms because there can be so many different things that can trigger either dizziness or vertigo. But let's first start with what the difference is between these two terms, because the ability to accurately describe what it is that you're experiencing is one of the first steps towards getting a more accurate diagnosis. When it comes to vertigo, that term is really exclusively used to describe a sense of spinning, whether that's a sense that the world is spinning or rotating around you, or a sense that you are rotating yourself. So it's almost an inner sense of rotation. So that's what true vertigo is. Now, there can be a lot of other symptoms that people experience that are inaccurately described as vertigo. And one of them is a sense of dizziness, or what some people call lightheadedness. So with dizziness, there is a sense of a disequilibrium where all of a sudden, perhaps your sense of being balanced is off. There could be a sense of lightheadedness in the sense that if this symptom gets worse, I might pass out. I might lose consciousness and fall over. So that's what's called presyncope. So with dizziness, there's often a sense of not feeling balanced or not feeling like you know exactly where you are in space, but there's no sense of spinning. And the other sensations I want to talk a little about too is that some people can almost feel a sense of floating, or they can even feel a sense of being pulled to one side or pulled to the ground. So these sense of floating or of maybe movement that's not there, or a sense of being pulled in one direction, that's also different from dizziness and different from vertigo. And these types of sensations can actually come from the inner ear, from specific organs in the inner ear called the otoliths. And so being able to accurately describe what it is that you're experiencing, like I said, is very important towards getting an accurate diagnosis. Going back to these otolithic organs, one of the other symptoms that people can describe related to those is a sense of rocking, or almost feeling like you're on a boat or standing on a free-floating raft on the water where there's a bit of waviness happening. Or that sensation of if you've been on a boat and you get off of the boat, suddenly you're on firm land and you have this sensation like you're still on the boat, and there's this sense of rocking. So all of these movements that I just described in terms of the rocking, floating, those can all be related to the otoliths. And again, that's part of the vestibular system, but a different part than what drives these sensations of spinning. And then the other thing I want to talk about is that if people are experiencing true vertigo, again, there can be lots of reasons why, lots of different potential situations that would cause vertigo. And some of these can be related to infections, and some are completely unrelated to infections. Some can be related to the actual anatomical vestibular system in the peripheral aspect, and some can be coming directly from the brain and the central nervous system. So again, this is why a differential diagnosis is so important, because treatment strategies really need to be based on accurate diagnoses. And in our clinic, we do ask a lot of questions, we do a lot of testing, and we also make appropriate referrals to make sure that all the tests that need to have happened in order to get that accurate diagnosis are happening. So we really are advocates for making sure that the patient has had all the proper tests done and have had all the proper things ruled out in order to really determine what's going on. And the last piece I want to touch on today that I'll probably talk much more about in a different video is this idea of vestibular migraines. Vestibular migraines have kind of become a wastebasket diagnosis where anybody that has some kind of vertigo or dizziness can get diagnosed with these. And I think that they're very misunderstood. So for starters, if we look at the classification of what should be considered a vestibular migraine, there absolutely has to have a pre-existing history of migraines without vertigo. There also have to be 5 separate episodes of vertigo type symptoms in order to, qualify for this diagnosis of vestibular migraine. And what I'm seeing in my practice is that a lot of people who don't meet these criteria, along with other criteria, are being diagnosed with vestibular migraines when perhaps that might not be the most appropriate or most accurate diagnosis. When the diagnosis of a vestibular migraine is an accurate one, well then there's a lot that we can do as well to actually address that. So again, I'll talk more about migraines and vestibular migraines in a different video, but I thought it would be important to bring that up since a lot of people with aspects of dizziness and migraine, or dizziness and vertigo often get labeled with this particular diagnosis. And a lot of the medications that are used to treat vestibular migraines are not so pleasant. They have a lot of side effects of making people feel very drowsy, very sluggish, and unable to function in their day-to-day lives. So the nice thing is that there are lots of natural alternative ways of addressing both migraines and vestibular migraines, as well as dizziness that can be done in the clinic. Thank you so much for listening. If you have questions, don't hesitate to call 651-323-0005, or you can email us at info@healingresponseneuro.com and visit our website listed below this video. Thanks so much for tuning in.